Right. We'll move on to the next speaker, Dr. Prabhu Shanker, who will be talking about nucleus management best suited for you.
Regarding the management of nucleus in FACO, we basically have three techniques. And okay. So either with divide and conquer technique, the stop and chop, and the direct chop. Here first I'll show the divide and conquer technique. Okay, initially what you do is create a deep trench in the center of the nucleus, almost up to the close to the rexis margin. And once you feel that depth is deep enough, then with the chopper in one hand and the phaco probe in the other hand, you can just divide the nucleus. See there, I'm going to be making the first chop there. This is basically divide and conquer technique, which most of us have to learn it in the initial days. And once the first trench is over, and the second trench, either you can directly go for a stop and chop, or you can directly again do a same similar procedure in the other quadrant of the nucleus. So try to make at least 4 to 6 quadrants in each nuclear fragment, and it's very easy to emulsify. So now again I'm fragmenting one more quadrant now. So once you around 6 fragments are there, then you can start emulsifying each quadrant. So only thing you have to be careful is the settings will change. If you're going for a direct chop and stop and chop, you don't have to change your phaco parameters. But when you're doing a divide and conquer technique, initially you want to do a deep trench. So you have to keep your vacuum around 100 and your phaco power around 40. So do the deep trenching, make the nucleus fragments. Once you have enough quadrants there, then you go for a setting. You can go for a vacuum around 300 or 400, then your phaco power around 50, depends on each machine. So now the new machines, you don't need much of power. Even 40 power, you can just manage the nucleus management. So always make sure when you're fragmenting the last nucleus where all the PCRNs occur, so make sure your tip faces the iris or towards the corneal plane. That's how you can avoid the surge when you're doing the last bit of phaco. Next to it. Next to it. Yeah. Initially, when you're doing your phaco, make sure you have a large capsular rexus around 5.5 to 6 millimeters, because the trouble starts when you do very small rexus around 4.5, where you'll end up hitting either the rexus margin or you cause a lot of stress over the zonules and get the ZD during the phaco emulsification. So initial days when you're starting phaco, make sure you do a very large rexus, at least 6 millimeters, so that even in case you want to convert to a SACS, it's very easy to convert. Achha. There's another case, same, I'm going to do the same trench, still with the second instrument either can be a dialer or a chopper. Initial days always make sure you use a dialer. So once you're pretty confident, then you can go for the chopper. So stabilize the nucleus with your left hand if you're a right hand surgeon. Then start the deep trench from one edge of the rexus margin to the other one. Always there's a confusion how deep to go. So always once your tip is already well buried, that shows that your depth is quite adequate, because always you don't know how far to trench, how deep to go. Sometimes they say that unless you get a good red reflex, you trench. Sometimes you go so deep that red nucleus becomes too much, and that means you already caught the PC. So make sure your tip is buried there. And once your tip is buried, then you go for the chop. See, this is almost stop and chop technique. So once you made the first initial divide and conquer, next fragments you can always go for the stop and chop. So each I've made it two semi-half nucleuses. Then each quadrant again you'll have to do multiple quadrants. So whenever there's a posterior capsular component there, sometimes your chop may not go through the center of the nucleus. So that times you'll have two different nucleus fragments there. So always try to remove the central core of the nucleus and then do the chopping. So here I'm using the horizontal chopper. So, but don't try to stuff the nucleus. I've seen a lot of surgeons using dialer and trying to stuff the nucleus into the phaco tip. You don't have to do that. The machine only will do it. So all you have to do is stabilize your phaco handpiece, and the pieces will come to you. You don't have to go and stuff the nucleus into the phaco tip. And make sure that we're doing the last emulsification. You can see my the video that my tip will face towards the next third one. So this both the techniques I've just showed, both divide and conquer and stop and chop. The last video is direct chop. Playing? No, start. No, same place. Just one more minute. Yeah, this is the direct chop there. I think it's gone back to the old video. Okay. This is the direct chop there. So you'll have to use a sharp chopper, either 1.5 millimeters, 2 millimeters horizontal, vertical chopper. So it's good for hard nucleuses. So you can initially making the first two big nucleus fragments, then you can chop each fragment. See, I'm using a sharp chopper and making small fragments with using the chopper. Then make sure you don't exaggerate too much force while rotating the nucleus. And that central nuclear part is the core one which needs to be removed before your remaining fragments come. So I'm just removing the central core now. Okay, just hold on piece and so each make multiple fragments and remove the nucleus. Don't try to bring a big fragment. That's the one time you will tend to get a SK. And make sure when you're doing the last piece of emulsification, make sure where my probe spacing is facing the iris plane, so that in case you have a surge, you'll not hit the posterior capsule. Thank you.
Thank you, Prabhu.